Our topic today, it's 141 on your list, your mouth, salivary glands, and teeth. Preventing and solving issues caused by treatments, including radioactive iodine or external beam radiation. We're really happy to have Dr. Mark Chambers handling this session with us today. He's definitely a ThyCa member, medical advisor, and has been for many years. And I'm sure you'll really enjoy his presentation. Dr. Chambers is chief of the section of oral oncology and maxillofacial prosthodontics in the Department of Head and Neck Surgery at the University of Texas, MD Anderson Cancer Center in Houston, Texas. He's the vice chair of research compliance and regulatory affairs. His clinical research efforts include studying the effects of stimulants, antibiotics, and enhancing the body's immune system to manage dry mouth and injuries to the mouth caused by radiation and chemotherapy. Dr. Chambers earned his DMD and an MS in biological sciences at the University of Louisville in Kentucky. Just a note about the chat box at the bottom. If you have questions as we're going through this material, please put your questions in the chat and Dr. Chambers will try and get to all of them, or as many as he can, during the course of his presentation. Thank you, everyone. Dr. Chambers.
So thank you, Candy, and thank you, Jeff, for helping to organize this session. And I want to welcome all of you today to for the next 45 minutes or so to discuss about the oral manifestations of iodine 131 or external beam radiation therapy to the thyroid. That includes also the salivary gland tissues. So I want to start off by thanking Gary Bloom, a longtime friend here in ThyCa, to invite us on your panels every year to be part of the supportive care experience of your program. And I'm so grateful for our camaraderie and friendship, and most grateful for all of you for attending this virtual session today. What a great program you have today and the next several days. So thank you, Gary. I want to begin by thanking all of my colleagues and also patients and industry partners that we've had at MD Anderson in advancing our knowledge in the effects of treatment that includes salivary glands and tissues of the oral cavity. So I want to start off by speaking to that we have I have no financial disclosure for this session. And my overview for today is to talk about oral complications of iodine 131 treatment and also external beam radiation treatment for thyroid disease, and give you some of my thoughts with regards to management strategies, and then also where we're headed, in my opinion, for future interventions. So I want to start off with this very complicated topic, as we have found ourselves over the years with patients like yourself that have experienced a great number of challenges that have come from treatment, such as with iodine 131 or with radiation treatment or immunotherapy, and particularly when the major salivary glands are well within the field of radiation. And so most of what I will present today, even though we deal with a great number of other oral complications within our section and our service, today I will want to focus more on salivary gland issues and the swelling of salivary gland tissue with its pain, and speak a little to what we know and what do we do to help patients like yourself that may be experiencing or have experienced such complications. So I certainly want to start off by speaking to the fact that radiation therapy has its own challenges impacting major tissues and salivary gland tissues, particularly when the treatment has been more than 2 gray of radiation. And we certainly will say that that's true for radioactive iodine, that when there have been doses that are greater than 100 millicuries, that salivary gland dysfunction can be substantial in a number of patients. And for patients who have other complications and other autoimmune disorders or taking medicines that are already drying out the oral cavity, this can be most certainly quite substantial. So I wanted to speak a little about what we do know from a literature review perspective of salivary gland dysfunction. And I want to start off with an older paper that we contributed to many years ago that looked at the impact of radioactive iodine on salivary gland function, particularly major salivary gland function, as it relates to the comfort of oral fluids in the mouth and in the upper oral digestive tract, and how the oral microbiome or the mouth in general, how it changes so substantially when a person goes through an impact such as with iodine 131 therapy, and that you see a dramatic shift in the bacteria levels and fungal contamination in patients that have this impact that is lifelong. And so this was one of our first contributions in the 90s of a study that we had that was what we call a longitudinal study, a long-term study that was evaluating patients during a state of about 10 to 20 years, and to assess the thyroid patients principally of what was happening in their oral cavity and the or upper oral digestive tract. And principally, this study showed the impact of what iodine 131, when it is injected and the ablation begins, what happens to its settlement in major salivary gland tissue and exocrine gland tissue. And many times what you will find is that there is a diminishing impact of salivary gland function over time once a iodine 131 is presented. The higher the dose, the higher the impact in the oral cavity, particularly with a salivary impact. And so what we found in this group of patients, following them for several years, is that patients became drier as the time went on, and bacterial and fungal colonization actually increased as well. So this was a major finding for us, and certainly changed the way that we were handling our patients as to oral care and guidance given to patients during the ablation and then thereafter. This study was followed by several others that have had great contribution as to knowledge of what principally radioactive iodine ablation can do to major salivary glands. And what has been found, even again, when the dosing is between 100 and 150 millicuries, what you can find is that there is a diminishing impact of salivary gland function over time. And so it is an impact with not only the salivary gland function and its secretion, but also with inflammation of the major salivary glands that can also lead to more discomfort and certainly change in taste. So a dryness, a swelling, and also with regards to a taste acuity change is what of what I'm presenting so far as complications that can occur with this type of cancer treatment. So chronic silidinitis, which is a complication that can occur after the course of an iodine 131 treatment, is probably the most frequent chronic complication after radioactive iodine has been administered for thyroid cancer. And to again establish its activity and also its impact on major salivary glands, our partners in Korea also contributed to a study that looked at what changes occur in salivary gland output. And it's done by way of an imaging assessment called scintigraphy, And what it shows is that there are substantial changes that do occur at the time of the ablation and then 5 years after the iodine has been administered. And so the conclusion of this very impacting paper that piggybacked on the earlier paper that we contributed at MD Anderson was showing that about 20% and up to 30% of major salivary glands can be dysfunctional with the introduction of 131 treatment, and especially when patients have had higher dosing than 150 millicuries. And so out of the major glands that one has parotid glands that are by your ear, and then under your chin, you have submandibular glands, and then deep into the floor of the mouth, you'll have these sublingual glands, and they're paired major salivary glands. What has been found with major study is that parotid glands are by far the most susceptible to iodine 131 damage, as well as external beam radiation damage. And the consequence of that damage usually turns out to be a dry mouth that we are going to call xerostomia. And that is then followed by submandibular gland impact, and then less of an impact to sublingual glands. However, all of these therapies potentially contributing towards dysfunction of salivary output. So that study was extremely important longitudinally. So it showed a great amount of changes that did occur in the output of salivary gland function. And why that is so important is because saliva is certainly more than water, and it's a complex fluid that can contribute to a great deal of good, particularly with keeping teeth and gums and bone in a much greater state and fighting bacterial, fungal contamination and viral contamination. And so again, it's much greater impact if we can have a change towards having greater salivary output than one actually has after treatment and has no intervention that contributes to a healthier oral cavity. So a drier versus a less drier oral cavity is going to have so many other changes. So our partners also, Doctors Mandel and Mandel did a great observation of what happened anatomically after 131 on some patients. And what happens to a great number of us after 131 has been administered is that the contribution of it and accumulating in glands such as the submandibular gland that you see on this slide, when the iodine gets into a contribution into this gland and accumulates into that gland, what happens over time is that you can start getting a stricture, a narrowing of the actual ducts that are anatomically highly necessary to have patency, so that it can be where saliva can flow appropriately into the ductal system and then into the oral cavity. And what has been found is that the 131 therapy longitudinally, long term, it can put stricture and a narrowing of that ductal stricture or that ductal anatomy, and it can lead an individual to pain, in addition to having much less saliva entering into the oral cavity, and hence a much drier mouth. This was a contribution, a great contribution to our knowledge of anatomical changes that occur. And then this was followed up by several studies that we have assessed as well, our patients as to those that have external beam radiation treatment for thyroid disease, in the head and neck for the radiation impact of those major salivary glands, and comparing it with our patients who have 131 therapy for thyroid disease. And the principal conclusion is that the greater the impact to the major salivary glands, the longer the challenge and the more complicated it becomes as to oral comfort and protections of the teeth and lessening of periodontal challenges. and lessening of oral pain. So this is a very important element in the lives of us in oral oncology, because what we find is that there is a great number of changes that do occur when more than 2 gray of external beam radiation treatment is impacting major salivary glands. And when you have more than 100 millicuries of 131 therapy, this is what you can see. You can see a change acutely, and you can see certainly a change from a chronic perspective. So more short term can be where you can have issues that occur in the soft tissues of the oral cavity, and particularly of controlling bacterial and fungal contamination that can lead to teeth sensitivity, that can lead to teeth breakdown, more cavities, et cetera. And chronically, long term, you certainly can see a change for taste acuity and being able to have more issues with a bone contribution when salivary function starts to diminish. You have less control of the overall oral health, and this can become very problematic for you and for your treating oral specialist. So that is a way of background, principally for dry mouth and for salivary gland inflammation and pain that comes from that. I want to speak a little with regards to how we go about looking at dry mouth and overall management. But let me start again by telling you that saliva is more than water. It's a complex bodily fluid, and it is so amazingly important in controlling bacteria, fungus, and viral contamination. And it's extremely important, particularly when controlling reflux and controlling pH and controlling early digestion. So all of this list is showing all the major ingredients of saliva, again, speaking to the fact that we have such a defense and a protection in our oral cavity. And then until the day comes that we lose it or start to see reduction in it, you don't greatly appreciate it. We have contributed a great deal of studies and publications on this topic. We see a great deal of change that occurs when salivary gland starts to have a reversal in its overall output. And what you find is that harmful bacteria greatly can increase in the upper aerodigestive tract, and then you start to see a decrease in more of the beneficial bacteria, particularly for early breakdown of food and early digestion and taste acuity. And so you then start to see changes. And here's a wonderful example of that with a person who has profound dry mouth and has had external beam treatment for treatment of a thyroid disease after a thyroidectomy, and the patient is now diminishing in oral health and having a great deal of change on the anatomy of the tongue, but also for taste and substantial dryness. And this can impact not only in the mouth, but it also can have a downstream impact as it goes, as the tissues go towards the stomach. And in addition to that, it can also change just the oral health of the tissues lining the cheeks and of the floor of the mouth, and principally in the oral pharynx, and can contribute towards some white lesions that we call leukoplakia. So patients will suffer for many patients, particularly for those that already have pre-existing dry mouth, and can be very problematic. So again, we are very in tune with how do we control this bacterial overload or this fungal contamination. And we see so many changes when the mouth starts to deteriorate and become drier. So it is quite well known about the oral microbiome, and a great amount of education over the years has influenced our knowledge from studies that show the impact of dryness and impact of medicines that can dry the oral cavity as well. of what happens to the balance of bacteria and fungus and the balance of harmful bacteria and beneficial bacteria. And it has been shown also that when there can be a substantial change in the oral microbiome with a very bad diet and a very altered change in bacterial influence, a person can also get a pre-malignant state of affairs in soft tissues. And so this particular study that is from Dr. Hayes and colleagues showed a great impact of what the oral microbiome, that oral environment, when it changes for many reasons, it can lead an individual also into developing pre-cancers presentations. Microbiome has also been shown to have an impact, and we certainly are learning more about this than ever, particularly with the diets of some of those patients that present to our service and having a great deal of alteration of health in certain tissues. And so we have found in literature and in studies that have been with our partners in the UT system that there is a linkage from the oral microbiome to also hyperthyroid disorders and again, pre-malignant changes and other. And so I would tell you that this is a very important element in our profession and in our clinics as to balancing and having a greater oral health so that we can have a greater, what we call homeostasis of the aerodigestive tract and have less challenges downstream because of all of the contamination upstream. So dry mouth and dry upper digestive tract can lead to fungal issues and to bacterial issues that eventually can lead to also bone breakdown and soft tissue changes. So for those of you that are listening to this presentation and have had dry mouth and are influenced by taste changes and or sensitivity of teeth, or having to go see the dentist for more fillings because teeth breaking down, you know what I'm referring to. So xerostomia, the dryness of the oral cavity, can lead to pain, and it can certainly lead to contamination with organisms. It can lead to taste alteration and more trouble with regards to reflux and swallowing. It can lead an individual to having poor overall nutrition and its downstream influence, and weight loss and quality of life being markedly decreased. And the other is what some may encounter, and that is when a drier mouth occurs, thickened mucinous secretions increase because it is from the sublingual glands way on the floor of the mouth and highly protected and less influenced by 131 or external beam is the secretor of these mucinous secretions. So in a laundry list of what I'm providing you here, really the top 10 list for saliva and why we need it is because of digestion. It certainly is influencing in the digestive process. And the second would be like unto it, and that is taste. And particularly when an individual starts to diminish in the salivary function, the protein gustin can greatly become diminished and your taste acuity can markedly be altered. So that what you love before treatment may certainly not be what you will love after therapy. So the other aspect of what saliva can do is it's a lubricant and it is a antiviral, antibacterial, and an antifungal to help keep homeostasis, this wonderful balance between contaminants. It is a cleanser. It allows for the cleansing of the oral cavity, particularly for those of us that are not the best in keeping the mouth clean. It protects, it repairs oral mucosal tissues. It helps in also remineralizing the teeth. It helps to repair enamel, and it helps to decrease sensitivity. So principally, saliva has a great deal of work that it does for us daily, and it has so many good elements to help with regards to prevention of challenges such as cavities and sensitivity and periodontal disease and biofilm accumulation, this thickened accumulation that happens on your soft tissues or your gum tissues or on the back of your throat. And then lastly, in a top 10 list, I would also say that buffering of what saliva can do is very influential in helping for those of us that have a very acidic and a highly a less or more acidic and more soft drinks, let's say with higher sucrose in our diets. Saliva, when it's competent, can certainly help to buffer and certainly can help to reduce challenges downstream again in the GI tract. So management of saliva is an important element here as well with regards to what have we been able to do to help our patients to increase their salivation and or with increasing all of what I'm sharing with you of all the good that comes from the ingredients of salivary function. And so for a stepwise approach of how we handle dryness, I would say that we will want to speak to a simple step forward for those that have gentle dryness of the mouth, and that would be to increase sugar-free lozenges and to also to increase oral moisturizers in the mouth. And that is usually salivary substitutes, and there are so many on the market. I'll introduce you to a few. We also want to reduce mouth rinses and lip protections and soft tissue protections that have a great deal of alcohol and or phenol ingredients that is for the preservation or preservative nature of these products. We want to use more products that have less of the alcohol and again, less of the phenol for protections. We will step up for those that have more moderate dry mouth or changes in alteration of just the comfort of the oral cavity by what we're going to call non-pharmacologic methods. And we'll do that with variety of types of water, such as aloe vera water, with ice therapy. We will consider using electromagnetic therapy of the major salivary glands through our TENS units. We will want to enhance products to be used that have no sugar and xylitol instead. We also will use what we have studied for about 25 years here at MD Anderson and the benefit of acupuncture using the 13 points of Nipchow, which has been shown to be a great advocate for individuals that have profound dryness and have used so many other agents to try to increase oral comfort. We have found the Nipchow approach to be very beneficial. Stepping up again of our approach to from something that is less invasive to that which is more from a medicine perspective, we'll call those pharmacotherapeutics. I will tell you that locally applied pharmacotherapeutics have had benefit. There are a great number of artificial salivary substitutes that are on the market that what we call sialagogues that can also increase salivary substitution and, or let's say salivary gland function, and to give that in substitution protections in the mouth. There's also other products that will have calcium and phosphate in it in order to stimulate salivary function. And one of the products that we advocate is called Cathosol. There are other freeze-dried products too that are on the market. I'll introduce you to a couple of those. And then we will ramp up to those patients that have profound dryness and have, again, attempted to use so many other agents with no success. We will consider a step up to what we call cholinergic agonists. And these are agents that are FDA approved for salivary enhancement, such as through pilocarpine or cevimeline or bethanechol. And these are products that are on the market that certainly can benefit salivary substitution and oral comfort. And we have contributed a great deal to the literature as to our studies on all of these agents. So from tips for relieving dry mouth, I would say that using sugarless drinks or ice chips can also be a great stimulant. We wanted to try to avoid crunching ice, and some individuals can't use ice at all because of the sensitivity of the mouth. I would say that also tea and black tea particularly, and herbal teas such as chamomile and green teas have also been shown to be so good with regards to stimulation. We want to avoid alcohol. We like our patients to avoid it. We like for our patients to avoid caffeine that have profound dryness, and of course, tobacco products. We like the xylitol products. We like the substitutions for salt and reducing of spices on foods. Some patients may have to have a humidifier used at night because of how dry their oral cavity or nasal passages are. And again, we also will advocate to our patients salivary substitution. We want to avoid alcohol and phenol containing mouthwashes. We think for those that are most profound in dryness, that sodium bicarbonate rinse is by far one of the greatest alternatives. Old Mama's recipe of salt and soda, but we actually take the salt out of it for many patients, is what we prefer, where we mix a teaspoon of sodium bicarb in 20 ounces of water, and we'll use that 2 to 3 times more per day in order to alkalinize the oral cavity and also increase that ability to reduce acidity in the upper aerodigestive tract. We like alkalinity over acidity because of its major challenge to the body functions. We customize at our institution and in our service our patient products and our education based on the state of affairs and the previous treatments. And what our goal setting is to use products that will heighten their overall oral health. And we want to reduce gingival problems and periodontal compromise. And of course, overall, as what you're hearing me is the undertones of most of this is what we can do to increase salivary output. We strongly like fluoride products. We think fluoride products are by far very important in fighting bacterial colonization. And we also increase salivary flow by way of sialagogues. And what we have found that has been one of the best on for us is out of Whole Foods group is Oasis. We have found the Oasis to be a very good partner in helping patients increase salivary substitution. We like the Laclead and the Biotine products. We think that this is a good alternative. However, very short-lived compared to what we believe is Oasis as to long-term success. And we also like a product that comes out of Florida that is a product that has a very nice element called spilanthes. And spilanthes is a natural herb that also increases salivary salivary function. And it's again a natural sialagogue, and it comes out of the MedActive group. This is a calcium and phosphate influence called Cathosol, and a product out of Texas is also one that we advocate. It's called Saliva Max. And this is for particularly individuals that have athus ulcers and have herpetic stomatitis or lip sores or athus sores in their mouth. And principally it's due to the dryness of the mouth or the cyclical viral problems that an individual may encounter. And calcium and phosphate are so enriching to increase wound healing capacity. So these are two products that we advocate for salivary substitution. And principally, the Saliva Max has been found to be of benefit on those patients that have this mucosal sloughing or a challenge with regards to the soft tissue comfort. There are a great number of products on the market. Just as a few that I thought was beneficial in our experience has been with Xyla melts that come out of the oral health group, and also Salivary, that is a dry mouth moisturizer. Some of these have aloe vera elements, some of these have spilanthes, and the majority of those that we really strongly advocate will have a ingredient of xylitol and no sugar and or sucrose. So the other is certainly what I'd like to share in our success of alternative therapies for patients that have had 131 induced dry mouth or external beam radiation therapy, conventional radiation therapy induced dry mouth. We have found in our numerous studies that the 13 points of NIPCHAL that we have advocated for over 20 years has certainly been of great consequence in improving salivary functions at varying levels for our patients. For those that have low to moderate salivary gland dysfunction, acupuncture can greatly enhance your overall comfort. And so going to a master acupuncturist and asking for salivary gland therapy through what we have studied a long time, again, is the 13 points of NIPCHAL, would be a very good plus for those of you that have had no success in some of the products that I've already have introduced. Silodenitis is a real challenge, and this can happen and occur immediately after 131 therapy. And it can also be a challenge that can happen chronically, that may be weeks to months after 131 treatment. And so this is inflammation, and this can be also as due to the accumulation of 131 in the gland, and then that treatment also atrophying or causing changes to the ductal system of the gland, as I shared earlier. And there becomes pain because saliva accumulates and it cannot readily be expressed. So that can be a very big issue. And so silodenitis is something that is very painful and has been part of our clinic therapies for a great number of years. And what we usually find is mostly the parotid glands, which are so sensitive to 131 and also traditional radiation treatment, that these are the glands that usually have to have massage therapy and or intervention in order to reduce the amount of discomfort, such as what you see in this illustration of this patient that has had this great amount of swelling. It almost looks like mumps, and the patient having this condition. When an individual has this type of challenge months after 131 and they present to our service bilaterally, this is also a problem that occurs that an individual could also have Sjogren's disease, which is an autoimmune disorder that needs to have intervention and treatment. So the higher the dose of millicuries of 131, typically the worse these type of presentations can actually occur. So here we would be doing massage therapy to try to control this inflammation of this parotid gland. And again, this is what we're going to classify under one catch-all term called parotitis. And this again is the inflammation of a parotid gland that can greatly enhance and become very, very painful. So the other is introduction of silodenoscopy as a treatment for these ducts that get strictures in them and or calculus or tartar in them that doesn't allow for the flow of salivary gland function after, if not years after, a 131 therapy. So Dr. Stephen Lai leads this effort at MD Anderson in our treatment of patients that have great suffering with silodenitis. And what this is an introduction microscopically through the ductal systems to evacuate, to actually clean out this tartar that actually can occur in the ductal systems. And also using a dilatation where we work towards getting the individual with regards to the severity of pain and the stricture of these ducts. Our goal setting is trying to increase the overall size of the ducts so that the salivary function can be much more readily expressive. So here's an example of that, which what we call the dilator system. And over a series of repeated introduction of this into the ducts, and again, this is done under general anesthesia, this is where we will place multiple dilators to increase the ductal system. And we will use towards the latter part of this procedure, then we will go and place into the end of the ductal system, which we call the Stenson's duct, particularly for parotid glands. We will place in a catheter to allow for greater expression or the secretion of saliva through the duct and into the oral cavity. And this has been a very successful part of our salivary therapy for patients that have substantial diminished impact of their treatment. So something that we find to be extremely important. This was put to a study, and so that we could show evidence-based medicine that sialodonoscopy does help our patients who have not only the swelling of those glands, but also the profound pain and the subsequent dryness. And so we published in Thyroid our findings on a group of patients that we have performed this particular procedure. And what this showed was that the majority of patients had resolution of symptoms. And it also showed that patients that did have the resolution of symptoms also benefited when we partnered this along with acupuncture. And so it may take for some individuals with profound dryness to have more than just one therapy that has to be introduced or considered. So we found that a great number of the patients that we treated had either complete resolution or a partial resolution, and the pain control was greatly influenced from that. So on my last few slides, I wanted to share with you that CancerNet is another great outfit that has a great number of publications that are specific to salivary gland dysfunction and sialidinitis and oral care and ways to get the oral cavity in better health after cancer treatment. And so we at MD Anderson also have a number of patient education tools that also are specific to this topic, which again, in my service, there are 7 of us as attending physicians that have spent most of our careers in looking at these type of challenges and side effects to treatment. So I think you may find by exploring these websites that you would find that there is information pertaining to some of the topics that I've brought up today. And then a free text that comes out of Wiley is a clinical guide that you may find to be very important read for those of you that have severe taste changes or severe dry mouth or severe challenges with swallowing. Is a textbook entitled Dry Mouth by Dr. Shribna. So I'm going to end on that note, and I wanted to spend a little time, hopefully, with you and with any questions that you may have that we can chat and discuss. So with that, I'm going to stop sharing and move to a chat line. So let's go into the chat line. So some of you have been very busy at typing some notes, which is so awesome. So there's a note here that came early on in this presentation that talked about for a diagnostic scan of about 5 millicuries, what are the current recommendations for using lemon drops or drinking fluids after swallowing the capsule? And I already have significant oral dryness from prior external beam treatment, and having had 150 millicuries, which we would expect that you would have that dryness. That's a great question. Yes, we still have great debate in whether it's better to stimulate the salivary glands or shut off the salivary glands. And there has been a great number of publications specific to it. But I would tell you that most of us prefer the stimulation side than to actually turn the glands off. So I think that stimulants in general are quite good during this time. And I think that those products that we can use that do not have sugar in them is a great way of increasing the benefit long term. And I feel that some of the artificial salivary substitutes can also be influential during this time that may have a lemon influence. I also like some of the waters that, like the Sani waters, that also have some very light flavoring that is not sugar flavored. And so I think that that is very true for better on the simulation side than the other. So thank you for that question. And the other was another question is, why is it recommended to see a dentist before the iodine treatment? And we say that because we want to make sure that your mouth is examined, and that if there is active infection and or periodontal compromise, that we swiftly reverse what you have before you go into a treatment that's going to have more long-term impact. And it's much better at the beginning to be able to reverse challenges, particularly when an individual may have 131 therapy and then have external beam treatment within a few months thereafter. I'll share with you that it is so important that a pre-treatment oral assessment is done in order to focus on infection and trying our very best to reverse it, if not eliminate it through surgery before a person goes into the treatment. So thank you for that question. We also think of it as an important element of having examination afterwards to determine from baseline what changes that you may have had. The next question would be, can you suggest things to help with swallowing issues after saliva reduction? I drink a lot of water all the time and still find issues with dry mouth. And again, hopefully you did get a chance to see some of those pathways that we will consider that are more homegrown and proven through our outcomes assessments, that with having products that have xylitol and no sugar, to use artificial salivary substitutes. We find aloe vera water to be an excellent stimulant. We find herbal teas to be a great stimulant and also good for the digestive tract, may I add. We want to keep the mouth clean. We want to reduce contamination by keeping the mouth clean. And I think that as one has to step up in having pharmacotherapeutics because of the severity of the dry mouth, there are other approaches that are there as well. Some that again are going to be pharmacologic, and then others that may have to be surgically considered in order to increase salivary output. Is drinking green tea beneficial? And it is so beneficial. And so is chamomile as well. We have found in our studies that black tea has been beneficial, and the tannins that are in some of the teas are so good and so beneficial to soft tissue, and that we have studied it even for oral premalignant reversal for those that have dysplasia, and seeing its role and its benefit in the reversal of leukoplakia and other oral premalignant states. So great question and a great product. Another is my experience was a salivary gland dysfunction after my second RAI. My doctor did not tell me of the side effect. In fact, made comments about what happens with mump-looking cheeks. this problem seems to persist, especially when eating dry things sticking to my mouth. And that is a real problem. And particularly with taste, and particularly with the swelling of the major salivary glands. What we would suggest is for you to be seen by a oral oncologist at one of the comprehensive cancer centers, and to see what suggestions that you may have in being referred to one of the centers that have those type of specialists. So thank you for that question. And it's a sad day if someone makes fun of the state of affairs that the mouth is in. I had a treating dose of 131 that was 126 millicuries, and also several 123 doses prior and post several years. I have an issue on the right side only, of course. I have a hard time swallowing small dry pills and very dry foods, and having pressure on that side. So this is also something that I would recommend. I spoke to it very briefly, but massage therapy and physical therapy to those major salivary glands on that side could be very beneficial. And using TENS units could be very beneficial. So seeking out a physical therapy group that has appreciation or in their repertoire that they are treating patients that have side effects from radiation to the head and neck, and or 131 therapy would be extremely important. I would say that again, for most of the comprehensive cancer centers, that the PT services are probably going to have that available. And you may not be able to see that in a great number of other locations in rural America. And so with the larger centers, you tend to have those larger supportive care services, and it's one that I would tell you to reach out to. And it's a great question, and it can only occur on one side. And you can see that when 131 or 126 is introduced, that you can get it deposited in much higher concentration on one gland on one side and have only one-sided issues. And that was also a challenge, as what I showed you in the picture of the gentleman that had the silodenitis. That also occurred with him, is that it contributed to one-sided pain. And always when he was eating or about to eat is when this pain would really start and become very problematic. So the other questions were related to dry eyes, and also the challenges with tearing. So again, yes, our partners in ophthalmology and in other supportive care services, such as with speech pathology, we actually wrote a paper more for immunotherapy agents that impact all three of our services equally. And I will tell you that the answer to that is yes, is that we have seen patients that also have dry ears, dry mouth, dry eyes, dry skin, dry throat, dry, really the full digestive tract. So again, what I would share with you is ophthalmologists that have their practices within cancer centers would also be another avenue that I would pursue, because many of them have seen these challenges that you're sharing with us. So it's a real issue. And another person is bringing up to me about xylitol and the toxicity that can happen for dogs. And many of the trials that we have studied, either being preclinical and or on our studies that are long term, both in vitro and in vivo have not shown toxicity to humans. And so that is what is still a seal of approval for us, because even when products go through a recommendation at our institution, we're also going to have continued assessment on these products. And I would say that that also is true for our fluoride products. And one is sending out a shout out. One person is sending a shout out to Dr. Lai, and I'll make sure he hears that, and he will be so proud to know that you appreciate him. Did you say that 20% of patients who have RAI have these problems chronically lifelong? And does this oral health deteriorate over time? Everyone who has RAI, do most people find effective ways to combat and maintain good oral health? And what are the stats on who get oral cancer after having RAI? So I'll share with you that with regards to the number of patients that we see that have acute complications with salivary gland is higher. So that could be even up to 40% after radioactive iodine, that a person could have a varying challenge with salivary function. That could be thick saliva, taste changes, or a drier mouth, oral comfort in general. But long term and longitudinally, I would tell you that yes, about 20% of our patients that have had 131 therapy, particularly, will end with challenges lifelong, challenges with regards to salivary gland function. And so those patients that we can see earlier, thereafter or immediately before the 131 therapy, is much greater, hopefully, for outcomes in putting them on prevention and putting them through treatment earlier than later, for an absolute consequence of being able to take care of these problems earlier than later. Again, managing through prevention. And as to the transformation after RAI to oral cancer, I would tell you that that is not something I could give you a statistic on. Is there any way to reduce incidence of these issues for someone undergoing RAI? And I feel that, again, the earlier, the greater the consequence. Having that baseline examination by a specialist in oral assessment would be very beneficial, or your general dentist assessing your mouth before you actually go through a RAI treatment, I think can certainly benefit you and benefit particularly with regards to the dryness impact when you have pre-existing problems. So pre-existing problems hopefully can be rectified before one would go into 131 treatment. Pre-existing problems such as open wounds in the mouth, substantial decay that's gotten to the nerve of the teeth, exposed bone in the oral cavity, heavy tartar on teeth that really should be debrided by a hygienist, all can, again, have great consequences. So thank you for that question. And as we go kind of to the bottom, I will skip a few just so I can see some of these earlier or later ones. These are all magnificent questions. I'm so sorry I can't get to all of them. What should be done at minimum after receiving RAI to prevent future salivary problems months or years later? So again, one of the things that I would say to you is that based on the amount of RAI that's been used, the higher, the more consequential, is that keeping the mouth clean, using fluoridated treatment for controlling bacterial colonization is extremely important. Increasing water in your diet is so awesome. Teas, again, are so great for the body. So that would be the first step towards maintaining a better approach to long-term health. I would say that the majority of those individuals that tend to have more consequences are ones that usually do not have dental intervention or never have, and are heavy smokers and have substantial alcohol consumption or other drug use. I would tell you have usually a worse longitudinal impact, a long-term impact. And so I think that all of this is extremely important. I will call it a common sense approach to mouth care, and doing a reversal on some of those bad habits before going into such definitive treatment can be so consequential. So I'll take one more, and I'll look at one here that came in at 226. And that was, I'm the one with the eye question, no corneal problems. I'm also a long time hard contact lens wear. My dry isn't so dry, but the wet one started tearing a few months ago. So it kind of is the opposite, isn't it? So then you ended up having like a foreign body response to increase that that tearing. I would tell you that most definitely you should seek out an ophthalmologist and that has a relationship to a cancer center and or reach out to a oncologic based ophthalmologist to get their opinion of that. So I will end there or at the end here. I am again very, very honored. I look forward to the next meeting that hopefully will be face to face and we can have a greater round table discussion and I can see you and you can see me more readily and we can be together hopefully in this next ThyCa series and annual session. So again, I want to thank my host. I want to thank Gary Bloom for inviting me again this year and including our oral oncology service at MD Anderson. And again, thank you so much for participating in today's chat line.
Thank you, Dr. Chambers. Very enlightening. I always get something every time I listen to you. A lot.
Thank you so
15
much.
years worth. Thank you so much. Thank
See you
you,
soon.
everyone.
Take care now.
Thank you.
Bye-bye.